So my name is Lee St. James. I'm the VP of Sales here at Global DWS, and we're delighted to have you here for our webinar on reducing documentation burden and increasing time for care. We're going to be sharing a case study about leveraging AI in long-term care with Monica Klein-Nouri and Faith Impolito from Meighen Health, the Salvation Army in Canada, and our two co-founders, Rami Webby and Yahya Saad, are also here with me today. So I'm going to begin now with a quick overview of Global DWS. So founded in 2013, Global DWS is a leading systems integrator, and DWS stands for Digital Workplace Services. And the company is really all about enabling smart workplaces. It's about helping customers leverage the latest technologies to improve safety and sustainability, increase productivity, and contribute to greater employee and customer satisfaction. So we see ourselves as your trusted advisors, and we're committed to supporting your business priorities by delivering efficient, affordable, and timely solutions. And I'm going to hand it over to Monica Klein-Nouri, the Executive Director at Meighen Health, to talk about their organization and the project that we did jointly together over the past year.
Hello, everyone. Thank you for joining us on this beginning of the week on a happy Monday. As Lee mentioned, I'm the Executive Director of Meighen Health Center, an organization owned and operated by the Salvation Army, and comprised of two buildings, Isabel and Arthur Meighen Manor, long-term care homes with 168 residents and 6 home areas, about 23 years old, years young, a 4-story building with a new HVAC system, and the Meighen Retirement Residence, about 60 years old building, a retirement home with 69 units and 6 stories.
So I'm going to continue with what Monica would be saying. At this point, I'm not sure how long it's going to take her to get back in, but we will go with the flow here. So we first met Monica back in September of 2024, or the summer of 2024, and her organization, she's a very visionary leader with some goals to modernize her operations, enhance resident care, and ensure regulatory compliance through advanced technologies. We undertook a technology adoption roadmap with her organization and creating a 3-year modernization plan. Here she is. And I'm going to welcome her back to the screen here. And we've started a series of different projects. The Connected Sensors project was the first one that we undertook. They also purchased a couple of social robots to augment their activity calendar and strengthen resident engagement and cognitive well-being. And today we're talking about the AI-enabled note-taking project. And this is really about more complete and timely documentation, reducing administrative burden, and enhancing resident care. So is Monica back? I accepted her, but I don't see her in the meeting.
My computer just decided to restart it, so I'm sorry about that.
That's okay. I went through the roadmap and got us into the setup for this project, so you're all set.
Yes. So thank you for filling in for me. The problem that we identify and the clinical need was regarding increased pressure for the documentation in our sector. Previous clinical documentation we identify as being inefficient and time-consuming. Gathering all data and connecting different places where data is stored in order to write an assessment, for example, was very time-consuming. Inputs from other providers like outside physician were needed to add it manually, and that was leading to gaps in our record. Also, workload pressures mean documentation was usually done at the end of the shift, later on, and because we are all humans, that means increased errors or possibility of errors and recollection of events not being so accurate as it should be. Definitely, when looking at clinical documentation, we can identify 5 types of documentation. One of them is the routine progress notes that happens on a regular basis. Others is related to observation and reporting. The third one, it refers to communication and escalation. And the fourth one encompasses all clinical assessment notes, such as SOAP notes. And the fifth one includes the comprehensive assessment and care planning. Different care activities require different forms or clinical documentation, as well know, and each note supports a connected clinical workflow and continuity of care. What we were looking for is a way to reduce the documentation effort and not replace clinical judgment. I think the takeaway notes is we were not looking to replace the human factor, but to enhance its ability to document correctly, accurately, and on time. Our approach was a clinician-led approach. The planning, development, and planning pilot deployment began with a focus scope on a nurse practitioner to validate its performance with the SOAP notes and documentation workflows. SOAP notes refer to objective assessment and plan notes, and they are considered the best practice in clinical documentation. Following successful validation and optimization, we expanded the solution to nurses and registered dietitian in our home and to additional care processes.
And now I'm going to hand it over to Rami and ask you, Rami, to take everybody through the solution that we selected and how Global DWS went about customizing this application and getting it ready for deployment with Meighen Health.
Yeah, thank you, Lee, and thank you, Monica, for starting with the introductions. And as Monica highlighted, like when Salvation Army started their program, they started from the strategy, and they put the 3 years strategy how to support the business and how to support the end user and the residents to make sure they answer the key questions. And during that journey, they specified the AI note taking will help them. But we, as a partner, we did not start with this technology discussion. We started, as you know, it's always people, process, and tools. So we started with the people factor, where Monica and Faith will share more information about how the people, they try to understand what is this technology, how it will help them, how they will be able to improve the quality of service that they will offer. And after we finish it from that strategy and trying to make sure we think that short-term, mid-term, and long-term with the right priority, we went to that documentation and about that, how we will make sure we understand the current process and transform the process. Because today, when you are looking to this kind of a program, you have opportunity. Either you can move from, sorry, if you can go back, you can start with only like map the current process, or you transform the process. So we spent time with the team to map the process and understand all the stakeholders to make sure we will be able to answer all the questions and have opportunity to optimize the process. What you see to the left, you see the whole process mapping with all the key stakeholders. And what you see to the right are the tools they are using today, between notes, between software, between point-and-click care. So there are a mix of things. So we want to make sure when we move to the new transformational AI solution, we don't want to miss anything. And we recognize, like what the team highlighted, that today they are working hard to offer the right service, but today the documentation, the medical documentation is fragmented. And we are inheriting a lot of practices that today we need to be compliant. So some of the information that goes to the enterprise health record, some of the information will go to Ontario Health, and plus currently the information will go to the paper And we recognize that today, at the end of the day, all the stakeholders, they need to sit together and capture all the documentation, which is taking time. And they can bring back time this to offer more advanced services to the end user. So we also try to understand the data management. It's not only the process, the tool, and people. We need to understand the data flow, how we will make sure we will not miss anything required by compliance. So the first answer, like after we have the spend time about the strategy, the people, and the process, now we start thinking about what is the right tool. Today, there are many AI tools in the market, but we recognize the Salvation Army main productivity tool, they use it in their home. It's the Microsoft Office 365. And Microsoft has Microsoft Dragon Copilot, which is an AI-powered clinical assistant that streamlines the healthcare workflow, powered by all Microsoft security, compliance, responsible AI. So this is like the customer shared with us, the responsible AI is their top priority. They want to make sure everything is secure end to end. And they want to make sure the new tool will not add complexity and the challenges to their day to day. So they don't need to do training on the new platform. So Microsoft Dragon Copilot was able to meet those after we review the main capability. And the main objective is how to reduce the administrative burden and enhance the efficiency. And it is trained on something they call it medical model. Like today, all of us, we know ChatGPT and many AI nodes in the market, they are trained in general models, which is large language model. Microsoft Dragon Copilot is trained on the medical terms. So anything like related to the medical will be able to recognize and it's ready to be trained. So the main three pillars of the Microsoft Dragon Copilot is not only streamline the documentation, because if we go back, like when we start talking about how we will capture the note, which is the first immediate quick win. So this is that which is streamline the documentation using the same standard, the same library, the same process. So this is a quick win using a voice, and we were able to capture the note end to end. But the second advantage is how to surface the information, because like when we need this information to review it with the family, with different stakeholders, we need to surface the information, which is the second pillar of this platform. So it's not only surfacing the information that you captured during the session, it will be also referred to the medical records where are and the standards. So it will help also not to go back to search about any medical references. It will be able to surface the medical information that if you need to take decision and action. And the last one, it's the automation. Like today, after we streamline the process, surface the information. Number three is after that, if you need to write a referral letter or to do anything after you finish the process, the platform has the capability to automate. So that's where you can see how the ones at the three stages, streamline the process, surface the information, and the automate the next step. And we understand it from our customers. Some of the houses, they have mobile phones. Some of them, they don't have it. They have a tablet. They have a desktop. So the Microsoft Dragon Copilot has three interfaces. It can work on the mobile phone, so you don't need to invest again additional devices. Or if you don't have a mobile or BYOD, you can use the browser or you can use a desktop by one click, and it's fully integrated with Microsoft. So simplicity, because we know our medical staff is very busy and we don't want to add additional overhead. So we have three options. Based on your available endpoint, you can use anyone that directly can, by one click, you enable the note taking using a voice interaction. So there are different interfaces. You can start by capturing the note as an assistant, and you can summarize, you can write queries to ask questions about what you collected, and also you can train the model. If you noticed, and now the team will do a demo, if you find that the system did not capture what, even it is very well trained about any medical, about multi-language, but you can also train the model to say, hey, I did not mean this. In our organization, I mean this when I'm writing that. So it's also, you can have a continuous training for the model. And the last one, which I really find it from the second pillar, as I highlighted, is an AI prompt query notes. So it's not, you can go back and you can ask all the question, and by voice, you can do the correction, you can coach that and provide that all Microsoft back-end model, and it will be fully integrated if you want to integrate with other enterprise health record. And we will talk about the integration and the analytics. So you can see how much it was accurate, how many errors, how much it is utilized, because also any AI And the responsible AI should be also measured. How's the efficiency and accuracy of everything we are using? So it has the capability by certain point milestone you can measure and to assess where it add value and where it will need to do correction.
I think we're now going to hand it over to Faith to do her demo.
Yeah, hi, good afternoon, everyone. So I will be sharing my experience using the Dragon Copilot to do this. You're seeing my screen right now. There you go. Are you seeing the right window now?
Yeah.
Okay. Okay, so as you can see here, this is my transcript. It's verbatim, everything I've said. I'm going to highlight here. You can also see the pauses. So in this case, this was a fragmented documentation. And I found that it compiles everything. So you can have fragmented documentation. Sometimes for me, it's intentional. In this case, it was unintentional. I was likely interrupted. So I returned again later. But for more of the intentional ones, it would be sometimes I might want to see different meal times. So lunch, return again at supper to provide more data. Or sometimes I call a family member, leave a voicemail and wait for them to return my call before I continue. Or I may add more information. Again, it compiles all the information. I end up with a cohesive note once the note is generated, which is right here, what it looks like. The other thing is I wanted to highlight that it's consistent in its ability to correct dictation errors. So as you can see, it captured MINTS, IMNTS, as I've highlighted here, texture. But once the note is generated, it corrected it to the appropriate terminology, which is, type it in there for you so you can see it. Minced is what I was trying to say, which probably sounds all the same when I say it, but I did correct it in all areas. So it captured it right here. As Rami said, it's quite good with capturing medical terminology, cyanocobalamin, multivitamins, that kind of thing, medication terms that I've dictated. It's quite good with that. Another example I wanted to highlight is its ability to do real-time correction. So just see here. I just want to point this out. During my dictation, I misstated that this resident had minced vegetable, beef and macaroni and cheese, mashed potatoes, and realize I misstated it. I meant to say minced pork, mashed potatoes, and vegetables. And I just simply said, sorry, this is what I wanted to say. And again, when the note was generated, it made the update change for me here and also corrected the spelling of the term. In terms of the workflow, once I'm done dictating, I come in here, I copy all to get all of this information. I paste that into Point Click Care, I make quick edits, and then I publish. Alternatively, there is an option from here to develop a prompt so you can ask it to generate a more concise SOAP note as I've done here. And I can copy that and paste it onto Point Click Care, make quick edits, and then finalize it. Personally, my experience has been that I've found the default generated note to be quite wordy. So this example here I've highlighted. She ingested minced pork, mashed potatoes, and mixed vegetables at a slow pace, necessitating frequent prompting and reassurance and expressed uncertainty. On the SOAP note, that is more concise. It takes away all the extra words. So I found this to be the most efficient, copying it, pasting it, because it requires minimal editing and it is easier to read. For us, that's important because our family members here have access to our EHR, so they can read, the residents or the families themselves can read the notes that we post on Point Click Care. The other example I wanted to show you is a recording of a multi-party interaction. So this is between myself and two other individuals post-hospital admission. So they came back from the hospital. You can see that it's only recognizing my name, but I did find that it was quite good at capturing all the key information from everyone that was involved. What I particularly like about this feature is that two things. It generates the note automatically and it filters out any irrelevant information. What I mean by that, any personal anecdotes, any unrelated historical data, it will take this 28 minutes and 35-second interview verbatim, and then it'll just generate a more concise note that includes only health and nutrition related information that I need. The other thing is it allows me to focus on the conversation. So getting involved with the conversation, active listening with the family members or the resident. And it also, because it's verbatim, it minimizes any risk for me to miss any information. So sometimes, especially at admissions, this has been useful because I'll get a lot of list of food preferences, for example, likes and dislikes. So it's been very useful for that. The workflow in this case, again, is the same. I copy all, I paste, and I edit on Point Click Care, and then I publish it. Overall, for me, the benefits and impact, it's reduced my documentation time. So even without the direct integration with Point Click Care, for me, I found it to be minimal in terms of the effort of copying, pasting, and then making the edit. When I compared it to my other documentation methods, for example, my Word templates and Excel templates, I consistently saved about 3 minutes per person, which doesn't sound like a lot for one person, but at the end of the day, it does add up. I've gone through my documentations in the 3 months that I've been using it, and my dictations are typically, on average, 5 minutes or less. I've also compared my nutritional assessments that I do on a quarterly and annual basis that's required for RAI. That compared to the previous way I was documenting with minimal interruptions, I can complete about 12 or more versus the 8 to 10 that I previously had. That of course can depend varying on, interactions with family members, if I have to speak to them, if I have to do any team follow-ups, and if I have to do multiple meal observations as part of my assessment. Another way I wanted to share that I found this to be very helpful is I can actually take my laptop, so it's mobile documentation essentially, especially when I do in-room assessments. I take it and I will dictate during my meal observation as I'm doing the swallowing assessment, pause it and then come back to it later and add any additional information. That has been extremely helpful in helping with my time and my efficiency. I would say overall, it's been a positive change for my workflow. I guess my final comment on it is that naturally it will vary from person to person depending on the individual workflow and more importantly, how comfortable you are with the technology.
Okay, great. Well, thank you very much, Faith.
Thank
Monica,
you.
I'm not sure if you wanted to say any more about the impact yet, but I can certainly have Yaya do another demo. I don't see any questions yet in the chat, but please remember, if you have any questions for Faith, Monica, or Rami or Yaya, please enter them or raise your hand and we'll try to get that addressed shortly. But maybe Yaya, do you want to pull up your demo slide?
Yes. So I am going to demo here with a colleague of mine, Alan, running through a quick demo of how Dragon Copilot can also help with supporting multilingual and patients speaking in different languages. And I know it doesn't make too much sense, but I'm going to be speaking in English. Alan is going to be responding back in Spanish, but it's mainly meant for patients that feel more comfortable with their own language, speaking their own language, and physicians or nurse practitioners that recognize the language and can respond back to them in English, and how all this information is then captured and processed within Dragon Copilot. So I'll be running a live demo. This is my Dragon Copilot. What I will do is I'll create a new patient session. I will name the patient session with Alan. Okay, and then I'm going to save and run the ambient recording for starting the discussion. So, hi Alan, I understand you've been feeling a bit lightheaded and dizzy. Can you tell me more about what's happening?
Sí, sobre todo cuando me levanto. Esta mañana cuando me levanté de la cama me sentí bastante mareado y me volvió a pasar cuando me levanté de la silla después del almuerzo.
Does the dizziness stay there when you're sitting or lying down?
No, cuando me siento por un minuto, normalmente se me pasa.
Did you pass out at any time?
No, no me desmayé.
Any chest pain, trouble breathing, racing heart, or new weakness?
No, no me duele el pecho, respiro bien, no he sentido nada de eso, no.
Okay, I'm going to check your blood pressure lying down first. So your blood pressure lying down is 118/68 and your heart rate is 72. Now I'm going to have you stand slowly. I'll stay beside you. Standing blood pressure is 96/60 and your heart rate is 88. Are you feeling lightheaded now?
Sí, un poquito. Es esa la sensación que he estado teniendo.
Okay, you can sit back down. I also noticed your mouth looks a little dry. Have you been drinking normally today?
Probablemente no. Creo que no he tomado mucha agua desde el desayuno.
Okay, I'm reviewing your medication list as well. You're currently taking hydralazine, 25 milligrams twice daily. Hydralazine, not hydroxyzine, and furosemide, 20 milligrams once daily. I'm going to document today's assessment and notify the physician about the change in your blood pressure when standing. We'll continue monitoring you, and please use the call bell before getting up until we've reassessed the dizziness.
Está bien, Lore.
If you develop any chest pain, trouble breathing, severe dizziness, now a new weakness, or feel like you're going to pass out, please let us know right away.
Está bien.
Okay, great. So what I'm going to do now is I'm going to stop the recording. Now, I was just recording the whole discussion, the whole ambient discussion on my phone, and I will be sharing now my screen to show the results of the whole discussion and what we've captured, and to show you the transcript. So this is the latest discussion I just had with Alan. And as you can see here, what was captured was the main transcript for the whole discussion. It shows all in English, so it has been like in real time translated into English. And as Faith mentioned earlier, there are some, during the transcription, based on the voice clarity, there are some terms that might be not captured clearly, but then when the information is processed, you can see clearly now all the information that's been captured and mapped through the SOAP process. So you can see here the subjective description of the present illness, and then over here the medication being taken, the symptoms, the objective assessment that was done, in addition to the assessment and the plan that is required, all in the same screen. You can access all this information, and as Rami mentioned earlier, you can always prompt and talk to surface the information and be able to talk to your model and be able to search through running a simple prompt, as like saying what medication was Alan on, and this will run through the whole record for the discussion, no matter how long the discussion is. Like Faith mentioned, a 30-minute discussion, and then pull all this information and surface it easily. And here showing you the medication, the dosage, and the number of like times the medication is being admitted throughout the day. So this is part of what I wanted to show, and mainly the capability of the multilingual and being able to surface information in a simple and easy manner.
Great. Thank you very much.
So the main impact regarding implementation of this technology is improved access to resident data at the point of care. By embedding this technology, AI, in our EHR, the healthcare professional can access the resident information, including history, in a fast manner, supporting a timely, effective, and informed care. The resident experience becomes seamless. Automated documentation ensure smoother care and transitions, reduce duplication, and ultimately leads to consistent and complete records. The structured AI notes and trends analysis, help inform better overall clinical decisions, and support improve outcomes for our residents. By implementing AI in our EHR, we support a more effective and more clear outcomes for our residents, improving the outcomes of resident care by addressing a more seamless documentation of the care provided.
Wonderful. Before I go on to the lessons learned slide, I do see a number of questions in the Q&A, so I think now would be a great time to ask them. From Tenzin Wozer, we have, can this translate any language? So I don't know if that's Rami or Yaya.
Yeah, currently it's a back-end Microsoft translator, which is, as I highlighted, I think they have more than 100 plus languages, and they keep adding more and more languages. The main languages that we know, they are available, and they are adding more and more languages. So it has multiple languages, and we can provide after this the updated list, because every month we have a new language added.
Wanisha Javed has a question. In my home, we have Copilot. Is there any extra cost for Dragon Copilot? I can address this. Yes, the Microsoft Dragon Copilot does have a licensing fee. So there are two different models, Physician Flex and the sort of a prepaid annual model. And that's something that we can certainly help you with. Arun Kumar, thank you. Congratulations, Faith, Monica, and Global DWS team on this initiative. Love the adoption of AI. Just a couple of quick questions. One, what are the metrics you are tracking to ensure the consistency and accuracy of output of Dragon Copilot, as we know that AI can hallucinate? How is PHIPA and PIPEDA governed, as Microsoft has a disclaimer that Dragon Copilot doesn't automatically protect the data of the resident or the healthcare provider? And I know that both probably Monica and Rami want to address this, so I'll hand it over to you both.
Let me answer the first question, with respect to the matrix, as Faith highlighted, in her current state, she's saving, like time saving to give back, to be able to offer, like to invest more time and the quality time with the residents. So timing is a key, and also the responses. Like when we started with different long-term care, we found that today there are some scenarios where they have some of our resident medical status, and because they did not have a chance to go back and to update the system, they send the patient to the hospital, and the system is still not updated. And this is in different scenarios. So it's like the quality of service that we offer is the top, and the time saving. And to go back to the second question, and based on Microsoft, they have all the certificate that the data is protected end to end. I'm more than happy to show all those certificates. But also, like when we talk about the certificate, it is protected from the system. But also our recommendation, it's not only the system is protecting the data, but also how people are using the data and how you do the configuration. That's where our time we spend. We review the process. We review with your security and your privacy team to make sure how we configure it end to end. It's based on your security and compliance. But consider today we are writing note on the paper. This paper also, there is exposure if we don't follow the certain practices. So that's part of our like professional services that we spend with our client to understand their policy, to make sure that AI is adopted in a fully responsible way. And plus, we rely heavily on Microsoft, because Microsoft is fully compliant with heavy regulated industry like healthcare and financial.
Yeah, Monica or Faith, you want to talk about the approvals or the requests for approval from the either the resident themselves or their caregiver or power of attorney before you start using AI in these situations?
On my end, at any time I do any court, I just request for consent. I explain what it is, what I'm using it for, the purpose of it, and they either say yay or nay, and I've never had anybody say no. So I has to just have the consent to record it so that I don't miss any information, and it captures everything that I need, and that essentially will get translated into point-click care, which they then have access to.
In addition to what Faith and Rami mentioned, I think it's a matter of governance also. Each organization must have their own framework and policies that are including the use of AI and explaining it very clearly how it's being implemented, under which circumstances, what you're trying to achieve, what are the fail-safes implemented, what are the audits, the frequency, and so on. How do you get consents? And as Rami mentioned, the fact that we are using Microsoft Dragon, this is not a new technology. This is not something that was now created. It has the brand that it's coming with its name, and the safety and acceptance throughout the world, not just in North America. All these pieces put together are giving you as organization the ability to stand behind implementing an AI solution for your EHR system.
The question from Goldie, and I think I'm interpreting this correctly. I'll be happy to answer it. It says, how many user profiles can you have on one subscription? And this is a perfect segue after the last question we just addressed. So given the need to authenticate the user, having access to the resident confidential information, there is one user per subscription. So each license that you buy is for a single person. It's not like you can't have one for all the doctors can share one license, that sort of thing.
Copilot, it's per user, but also there are two scenarios. One, if you need, you buy by one user all the capabilities related to the AI. So it will be one package. Or if you have multiple users and you want to optimize the cost of utilization, there is another option where you can buy per user, but all the computing will be centralized. So if you have 5-6 users, you can reduce the cost. And we can help you, our role also to support you to find the best cost-effective model, so you'll not go with the most expensive. And I see another question similar to this one about if you have on-prem deployment. This is also part of the design. We sit together with your IT or with your consulting team to understand what is your right model, and we will leverage your existing infrastructure. So we will not add any complexity. But Microsoft has the two models, one complete per user, and you'll buy everything. But if you have your own Azure backend infrastructure, we can spin a service, and that will reduce the cost. I know it's a technical answer, but the good thing with this model, there are options for you to optimize on the number of users who are using that. So if it is one user, it's better to go with one license. You buy everything, so you minimize the infrastructure. If you have multiple users, multiple locations, also you have options. This platform has been deployed in many hospitals, many regulated business, and that's why we have options.
Okay, great. And there's another question here before we go to lessons learned. I know, Monica, you're probably chomping at the bit to answer that one, but I will ask Tenzin has another question. I'm curious about how it works in practice. Have nurses had any issues with background noise or glitches when they're dictating their notes, and how does the home manage it?
I will say when I've taken it as a kind of a mobile dictation, it definitely is more conducive for the in-room assessments versus the dining room environment, because there's a lot happening. In the multi-party interview that I had shown you, that was actually in a nursing station, and it does capture anything loud enough into there. But as I said, anything that's irrelevant into what you're trying to obtain from a clinical standpoint, it doesn't include it. We do have 2 nurses on the unit, and I did speak to them to get their feedback. They do find that the interruptions sometimes it's not the best, But again, it does filter out any irrelevant information once it generates that note. So they still find it to be more useful, and it helps with their time management better than if they were to type. Because sometimes you're documenting something, you get interrupted, or someone comes into a nursing station. If you don't save that as a draft, or if you don't save it somewhere, you've lost it. So you've lost your time on it. Overall, the general feedback is that they prefer the dictation over the typing and documentation. It's faster.
Yeah, and I would like to add one additional, like what Faith shared her experience using the existing mobile device or tablet. But if you have very noisy environment and you still need to capture, there are options to use different mic, which with the noise cancellation. And the good thing, like Microsoft has a partnership with different hardware, but this is an additional cost. If you think you have a very noisy place, there are options, but it will be either a mic and different device that will cancel all the noise, and it will improve even from capturing all the notes.
Great. There is another question here. How was the training and onboarding process of the technology with frontline staff? If there were challenges, how did you overcome them?
Yeah, I think I will be able to answer, and I know you are expert in this domain, and we take it very serious about any new deployment. And what Monica and Faith always highlight, it's a human first, it's a human centric. We don't deploy technology like Monica in the first day when she put the strategy, she highlighted, I don't want to add any new technology that will not consider the team. So we follow practices, organizational change management, OCM, which is very structured, the process based on the process of a change management to understand who are the main stakeholders. And we go through that change management between training, documentation, also follow up. So there is very structured, and we understand this is like today we are changing the front line from transformational. It's not about the technology, it's about people, how they will use it and how they will see will help them to be more efficient in their day-to-day. So we have a framework, a complete framework that we share it from day one, and we will use it to close the project to make sure all the team is trained.
I just want to add that, as you can see from the lessons learned here, and Monica, I'll have you address these topics next, but building confidence through, first of all, narrowing the scope and making sure that you have a good, like what I'll call like ambassador to start with, like Faith just like totally grabbed onto this, and now she's available as a frontline resource for her colleagues if they have questions. And Global DWS offers obviously ongoing support and training, and that's part of the model that Rami talked about. But the idea is really about managing the scope of your project, so you're not trying to like boil the ocean. Just like, what can you do? Get early wins, get confidence, start to measure those success metrics, and then people will feel less threatened about taking it on, right? And I think also one of the things I want to add, and we've talked about this before on previous webinars, if you haven't been on, Monica really has created a culture of learning in her home where people are allowed to ask questions, they're allowed to try things, they're allowed to challenge the status quo. And so that's really where as you build that confidence, it's not just for the leadership, but it's also for all of the employees as well, and even residents and family caregivers. So I think that it's that open communication, and you're not expecting everybody to go from 0 to 100, in the first week. You really have to give them time and be patient, and sort of walk slowly until you're ready to run. So hopefully that addresses it. Monica, did you want to address some of our lessons learned? And then we have just a few more minutes left.
I think you kind of cover everything, but I would say always think about what problem are you trying to address. That's the reason a gap analysis, an assessment of your operational needs will show the workflow gaps and how ready is your organization for adoption of such technology. And as Lee just mentioned, choose from those issues, from those identified gaps, the one that would make a greater impact, but at the same time will use least effort. If you want, it seems complicated, but it's not complicated. When you do your assessment, you will be able to identify which case scenario, it's gonna be the one that you have to address. Yes, it's nice to implement something in the entire home, but we all know from implementing new things, the change management, it's not on our side if we want to be successful. We need to choose a one case scenario, address that, and work from that to expand. In our case, we chose the nurse practitioner. We validated and optimized that case scenario, and after that went to the one that allows nurses and dietitian to document, and now we are moving to include others. Also extremely important is to build leadership, to build that confidence, exactly as Lee mentioned, that frontline staff are able to have that permission to dream big, to ask questions, to challenge the status quo. And they can get there just if they are supported in this journey. Adequate education, explaining what that technology is about, starting with the basis. It's a very important step in creating that culture of innovation and adoption of new technologies. Last but not least, you're gonna hear me saying this again and again, AI, it's a tool. It's a strategy that we use to enable a more efficient care delivery, not a standalone technology, not something that we're looking to have taking over the responsibilities of our staff or our healthcare providers. It's something that would enable them to work more efficient and to reach those outcomes on resident care that we all are aiming for.
Wonderful. I think I'm gonna hand it over to Rami now for a little bit of future-looking commentary. I don't see any other questions in the chat. So Rami, do you wanna take us through these next few slides?
Yeah, as the team highlighted, I think it's all about how we will be able to offer back and save time for our medical staff to be able to support the resident. And currently, like based on the statistics, Faith shared with us, she's able to save 3 minutes per session based on the American Medical Association. They highlighted by using the right AI tool, you would be able to save around 5 minutes. But it depends on that and with the approach and with the workflow and the template. And this is where we are always like today, is not also to bring Dragon Copilot. We all use Copilot. We found there are many options. How we design it, how we put it, how we leverage the right library, the right workflow. So also we're not adding complexity. So by saving 5 minutes, we will find how this 5 minutes we will reinvest in supporting, improving the quality and increase the collaboration between the staff to be able to have more advanced environment. We found as part of our experience when we start working with different clients like Salvation Army, we found there are a library. So each organization, they follow a different workflow, and so the tool should follow that workflow. So we prepared list of libraries, and based on the templates, based on the workflow, so you don't need to re-engineer everything. So working together, working with your team, trying to understanding the process. We will not ask you to do the configuration. We will be bringing our experience and all what we saw from the mapping the process. Even if we have opportunity to transform the process with you, we will come up with the libraries, with the experience, and with the different kind of integration point that we will be able to offer. So it's not only all the capability that Microsoft Dragon Copilot is bringing to us with all that security, compliance, and responsible AI, also the configuration, how fast we will be able. So you see list of libraries, and those are based on understanding, working with subject matter experts from the healthcare to make sure what we are following, we are not just bringing our AI and experience and technology experience, we are bringing something relevant to what will be able to help your team in the right structure and the right format. Yeah, okay, so here the last one about the interoperability. Started like as we highlighted, and Monica highlighted very clear, which problem we are solving. So we can streamline the whole process and make it fully integrated with all those systems. But we found that most of the time it's during the sessions, during the capturing the notes. So we started with that to make sure we stream the process end to end. But today, Dragon Copilot, working with our team, we have the experience to integrate as open API to be able to integrate with any EHR based on how much you will, how many systems, what kind of complexity, but that's needs some setting and coordination with your IT. And the most important thing, it's also the automation. And you know the AI, it's a journey. You start with the foundation, try to solve the short-term and the technical problem. But when you start having maturity and you see the process and the team are all working together, you will be able to add more agentic capability, which the platform has that. When I say agentic, so you can see what can you automate. So you can save more time and make sure more efficient. And this is like as a second stage of your AI journey that will help you in your organization.
Okay, great. Well, thank you everybody for joining us today. I've added as our last slide here Monica's email, Rami's, and my email. Obviously, we welcome any questions that you might have after this session, and I'll be following up. I'll send out a link to the recording to all those who registered, and I'm really thankful for your time today, and we hope that it's been a valuable conversation. And thank you again to Monica and Faith for your fabulous demos and your partnership on this project, and thank you Rami and Yaya and Alan for the demo.
Thank you.